Hello friends, hi, this is Dr. Shonali Chandra. We've all read the news. Next is on the way. Now, dear friends, over the past 2 to 3 years, yes, there has been a lot of discussion among the medical fraternity and medical students regarding this national exit test, NExT examination, we call it. And recently, about a week ago, the National Medical Commission also released the proposed draft regulations related to this national exit test. Now, as of now, these are draft regulations, right? Seeking comments of the stakeholders involved in the process. In this public notice, per se, they do not specifically tell as to when this will become implementable, but the speculation is that from the year 2024 onwards, there isn't going to be the final year professional MBBS examination or the various NEET PG or INI-CET postgrad medical entrance examinations. Instead, there is going to be this NExT examination. So while going through these draft regulations, for once I started thinking like a student. I mean, I was gripped by moments of fear and anxiety. Change is never an easy process. And the one question that I want to answer in this video is what I can do about it. I mean, I don't want to nitpick on the draft regulations which are proposed, but answer a very basic fundamental question. Do I need to change my strategy? Do I need to prioritize things differently? How this will affect the way I study, right? So before I answer this question, let us also have a look at the broad overview of what this NExT examination is going to be. They propose that it is going to be conducted in two parts, NExT Step 1 and NExT Step 2, right? So once we complete our final year MBBS Prof, we are going to sit for the NExT Step 1. Now, this NExT Step 1 is going to be a theoretical examination. One or more than one type of MCQs will be asked, computer-based online test, and a centralized common all India examination. To pass this, we need to individually pass in all subjects with a 50% of aggregate marks. And what are these subjects going to be? 6 papers. Okay, medicine and allied disciplines, 120 questions to be done in 3 hours. Surgery and allied disciplines, same, 120 in 3 hours. Obs and gynae, 120 questions in 3 hours. Peds, 60 questions in 1.5 hours. And similarly, ENT Ophthal also 60 questions each. And along with this, applied aspects of all subjects which we read in the foundation year subjects like anatomy, physiology, biochemistry, pharmacology, forensic medicine, PSM, pathology. Applied aspects of all of these subjects will also be included. So it's like preparing for the NEET PG or INI-CET entrance examination itself. Now, once we pass this NExT Step 1, we will sit for the NExT Step 2. Now, this NExT Step 2 is going to be conducted in the respective medical colleges. It's a clinical examination, viva and case presentations and everything, covering the same set of subjects, including ortho separately as well. Now, once we pass this NExT Step 2, so we pass NExT Step 1, we pass NExT Step 2. In NExT Step 2, we'll only be mentioned as pass and fail. And the score that we'll get, the percentage score that we'll get is for the NExT Step 1. Once we pass these 2 steps, we become eligible for an internship, right? We become eligible for, clinical practice. So that is why it is an exit test. And we also become eligible for the postgraduate medical seats based on the scores of NExT Step 1 examination, right? So yes, it's a drastic change, agreed, right? And I don't want to sound cliche when I say that change is an opportunity and change makes you stronger and difficulties make you stronger. We've all read the good quotes. We have. But the basic fundamental question here is, how do we change our study pattern? Does it need to change at all, right? And when you ask this question, the first thing that I also felt, and I would have felt had I been in your situation, is fear, anxiety, right? And I believe that fear is not a good starting point to make any strategy, right? So let's keep the fear and anxiety aside. If this does become implementable, we will have to think about the changes ahead, right? Before seeing the changes ahead, let us also look back look back over the changes in the NEET PG and INI CET pattern that we'd been observing over the past 4-5 years, right? More and more clinical case scenario based questions, lengthy questions, integrated questions among various subjects, they were being asked, right? More weightage given to clinical subjects, yes, right? That doesn't mean that the foundation subjects are not important. Let me also tell you this much at least, right? So we've been seeing a shift in pattern in NEET PG and INI CET, and what they're proposing to do is in NExT is that 65% of the questions will be analytical, problem solving, clinical case scenario based, and there will be recall questions may only be 10%. That is what they're proposing in this draft regulation. That doesn't mean that the foundation subjects are not important. I mean, even though you have to attempt 120 questions in medicine, 120 in obs-gynae, 120 in surgery, that does not mean that pathology, anatomy, physiology, biochemistry is not important, right? Because again, the questions will be integrated. So you could have a clinical case scenario based question, and in that clinical case scenario, you could be asked the pathology of the disease being discussed as an example. So more and more integrated questions are expected. The second important point is, if you have to answer so many questions from a single subject, right? Does that mean that you need to study more? By studying more, I don't mean more course which becomes unrevisable in the end, right? So studying too little, never good. Studying too much, so much so that it becomes unrevisable in the end is not a good strategy. You need to study smart and not more. What does that mean? That simply means that, and I have always been asked this question by students as to what are the important topics, right, in a particular subject, let's say, for that matter. So I always say that whatever you see in the OPD, whatever you see in your clinics, in your wards, I mean the patients and the cases that you see, they are all important. They're the most important, right? Secondly, by extension, anything that is associated with that particular disease or condition becomes important. The anatomy of the particular disease, if you're talking about surgical conditions, the anatomy of that particular system becomes important. Like for example, if you want to read about asthma in medicine, right, you can't just leave out the respiratory system physiology out and think about only talking about the diseases. So yes, what is important is system-wise approach, right? Maybe not subject-wise, but system-wise. Like for example, let's say tuberculosis, very common in our country, right? Found in all age groups, right? Can lead to chest complications, respiratory disturbances. In the females, it can lead to genitourinary tuberculosis and infertility and so many different aspects. So once I start reading about tuberculosis, the tubercle bacilli and the microbiology of Mycobacterium tuberculosis becomes important, right? When I talk about how it affects the lungs, then the respiratory physiology becomes important. When I start talking about how it affects the female's fertility, then the understanding of female fertility and infertility also becomes important, right? So system-wise approach is important, right? So let's say, for example, in surgery, you want to talk about cholelithiasis or any other, gastrointestinal condition, then you'll have to start with the anatomy of the hepatobiliary tract, right? The physiology of the bile duct and the bile system, right? Then you will understand the gallstone formation, right? So the system-wise approach is what is going to make a difference in your preparation. That is how I feel about it. Now, when I say certain topics are more important, right, I'm saying that because if NExT is implemented, then the amount of stuff that you have to study for that particular next step 6 subjects that you have to read along with the allied subject, it's a huge amount of course, right? And you're doing that at the end of your final year professional examination. So you cannot be piling up and reading everything that is there, right? You have to study smart. Only certain topics which have been, will always be important, should be your top priority. That doesn't mean that you cannot study more. I don't mean that. I mean, if you have done your basic course and you want to add on to that preparation, you can, but you cannot go about reading the one-off asked questions and ignoring the rest of the important topics, right? And the next very important questions, what to do about these clinical scenario based questions, about these integrated questions. Because so far, we've been reading, let's say, a little differently. I mean, we've been reading, anatomy, physiology, biochemistry, pathology in our foundation year, in first year and second year. And in those years, we have ample time to strengthen the foundation year subjects. They are still very important, but we have to, every time while reading those subjects, keep the clinical perspective in mind, right? If we've not been able to do that in first year and second year while reading the important topics, when we're doing again in final year or third year professional, we need to go back to the applied clinical aspects of each of the foundation year subjects as well and integrate that into our preparation. I'll give you an example. I can understand that it can become very theoretical when I keep giving you the important good things to do. But let's just take an example of a very common clinical situation in our country, and that is anemia. Let's see how I will integrate my understanding of anemia. Anemia is low oxygen carrying capacity of the blood. That's the definition of anemia given in the pathology textbooks. Right? Oxygen is carried in our blood by the red cells. So you can't understand anemia without understanding RBC morphology. You read about this in physiology and pathology. You can't understand this by leaving oxygen transport or hemoglobin synthesis. You need to be aware of these points and be aware of these dynamics before you start understanding the clinical topic, that is anemia. And this you cover in your physiology and in your biochemistry as well. And then you read up with the different pathological types of anemia in your pathology. So anemia could be because of RBC impaired production, right? Anemia could be because of blood loss. Anemia could be because of RBC destruction that we call as hemolysis, and so on and so forth. You have a huge classification of anemia that you read up in physiology. Then you also understand how oxygen is important for our body, for our proper functioning, right? And then you also try to understand what are the clinical symptoms of anemia. And then you go see a patient with clinical features suggestive of anemia, like fatigue, lack of concentration, like maybe in severe cases of anemia, breathlessness, right? So you see a patient with clinical features of anemia. You have that much understanding based on your foundation year subjects alone as to what anemia is all about. But now you have to integrate it into a clinical perspective. That is, when I see a patient of anemia, there could be other possible differential diagnosis as well. Like if there is severe anemia and the patient is breathless, there could be maybe breathlessness because of some respiratory illness. There could be breathlessness maybe because of some heart disease condition. And then you have to go about differentiating the differential diagnosis to come to one diagnosis of anemia. Right? So you will have to know what are the differentiating features among the various differential diagnoses, right? So I say yes, topic is important. A clinical presentation is important. From that aclinical presentation suggestive of anemia, we branch out into the various aspects of the anatomy, the physiology, the biochemistry, the pathology of it all, right? And we revise everything, we integrate everything, right? And then you have to confirm the diagnosis of anemia, right? To confirm the diagnosis of anemia, you'll need certain basic set of blood tests. You need at least a hemoglobin, hematocrit, and the rest. How will you differentiate between iron deficiency and thalassemia? How will you differentiate between iron deficiency or RBC destruction associated with hemolysis, and so on and so forth? And you will have to integrate it all, right? So yes, my dear friends, once you are done confirming the diagnosis, then you come to the medicine of it. So far, foundation year subjects are helping you, right? Then you come to the medicine of it. Medicine of it meaning clinical management, the diagnosis and the treatment, right? So once you start talking about the treatment of anemia, you'll think about, if it's iron deficiency anemia, I need to give this set of drugs. I need to give oral iron and folic acid, right? So if you have to give oral iron folic acid, you will have to know the pharmacology of it. You will have to know about the iron preparations that are there, oral, injectable, so on and so forth, right? You will also have to know about the mechanics of iron absorption in the body, going back to physiology, again, going back to pathology, again. And this is how you are going to integrate your understanding of a clinical topic, right? It is time consuming, I would say, right? Because you're not getting, maybe in the examination, asking you questions like what is the most common type of anemia, or giving you a clear-cut diagnosis that this is the hemoglobin level, is this anemia or not? This sort of questions are no longer being asked. You're being given a clinical scenario of a patient presenting with fatigue and breathlessness, right? You may be given a clinical profile of the patient, like for example, if a patient is looking malnourished, if from a low socioeconomic society, you can think about nutritional anemia as a possibility. But if you have, let's say for example, a clinical situation where the patient is having similar symptoms of anemia and is a tribal on the other hand, right? And you will also have to think about the possibility of hemoglobinopathies which are prevalent in that particular tribal population. Like for example, in Jharkhand and Chhattisgarh of our country, you have tribal populations which have sickle cell anemia. Then you start thinking about that as well, right? So analytical approach is what this is called. You can analyze the situations, right? If a particular situation is given to you, you can, based on your foundations of knowledge and clinical concepts, come to the diagnosis, right? In medical practice, in examinations, this is the key. Start thinking about clinical situations, all right? Because when you read the textbooks, anemia is given as one chapter, but then you also have to integrate your understanding of the patient if you are going to attempt the clinical scenario based questions, and they will come with practice. This becomes a time consuming process when you have to keep going back to revise, but it is better to read the most important topics again and again and again, rather than to study everything that is under the sun and then expect that you would remember it all on the final day of the examination. So read smart, right? Read appropriate. Do not live in FOMO, fear of missing out, and keep the fear aside. If this does become implementable, we have to maybe put in a lot of hard work, I feel, in the first year and final, in the first year, second year and foundation year subjects. The clinical concepts are built on those foundations, and then it becomes easier to read the clinical subjects as well. Big subjects like medicine, surgery, obs-gynae, they become easier once your foundations are strong, right? And there is another video that I've done a couple of weeks ago regarding how to read clinical subjects faster. That I have discussed about this differential diagnosis approach in more elaborate way as well. Thank you for watching.